Joining us now to discuss the latest COVID-19 developments, our infectious diseases specialist and Queen's University professor, Dr. Gerald Evans, epidemiologist Deonandan, and the head of critical care at Scarborough Health Network, Dr. Martin Betts. Great to have you all here this evening. Dr. Evans, I'd like to start with you. On the one hand, the province is approaching the benchmarks eligible for stage 2, but we're also adding new hot zone variants that are concerns for Delta. And there's this mixed messaging between the medical officer of health and the premier. How do you assess the situation we're in right now in terms of reopening or not?
Well, I think we're starting to see and continue to see a theme with this pandemic, and that is that everything kind of will change on a dime. And one of the things that we're dealing with right now is trying to assess what impact this Delta variant is going to have. It is clearly more transmissible than the Alpha variant, and that was more transmissible than the original virus that started the COVID-19 pandemic. And so we do know that there's a good effect from vaccine, especially 2 shots. In terms of reducing the potential for transmission of the Delta variant. And I think what we really need is a period of time, and it's probably about another couple of weeks, to sort of see how that strategy is working and to also determine how much further the Delta variant's going to sort of emerge from what is right now, a high predominance within the isolates that have been found, but still very small numbers. So again, I would just really, exercise a lot of caution. And I think that government would be well put to stick to the timelines that they already had laid out.
Oh, interesting. And it feels like it's the last leg of that race, right, between the virus and the vaccines. But now this variant, Raywat, how strong or how successful do you think Delta could be when it comes to these vaccines in the province?
Delta is the final great challenge we have to deal with. And right now, it is a battle between vaccines and Delta. It's always been a battle between vaccines and the virus, but we have the virus mostly conquered. It's just Delta is the last little point that we have to deal with. Right now, in Ontario, it looks like the extent to which we know where Delta is, it is growing exponentially. The R is greater than 1 for Delta. For the rest of the disease, and for the province overall, it's less than 1. So we're seeing a decline in cases overall, but those cases that we know are Delta-driven are expanding. Our solution has to be vaccinate quickly. 2 doses has to be the priority. And I'm with Dr. Evans. We cannot open up early. We have to stick to the plan. It's a good plan. Let's just stick to the plan and see what happens.
That's interesting. And also on the opening up early, a lot was made last night. Toronto General Hospital's MSICU, they came out, Dr. Betts, and they said that they had no COVID patients in the MSICU at Toronto General Hospital. Well, there was a lot of kind of, I don't want to call it backlash, but sort of talk back and questioning of those numbers, particularly from people, ICU doctors like yourself, who were contacting me saying, I feel like this is a PR move or a sort of publicity stunt. What is your assessment of that announcement last night of no COVID patients in the MSICU there?
I have many friends and great colleagues in that ICU, and there probably isn't anywhere in the world that if you were unfortunately stricken with critical illness that you'd want to be than in the Toronto General ICU. As many of us know, what they were celebrating was the end of having infectious patients. And so what that means is that someone's developed an illness of COVID illness, and a certain period of time has elapsed that they're unlikely to be shedding infectious viral particles. But we know, as of today's report, they still have 27 patients in their ICU that are dealing with the consequences of COVID, still affecting their system, as many of us do across our intensive care units. I think it's a celebration that we see hope on the horizon with the work that the public health interventions have done and the vaccines have done. But we all know there's still a tall task ahead of us. We still have patients that need to recover. We've got patients that are going to need even long-term care because of the consequences to their system. And we'll be ready to celebrate at some point in the future, all as a team.
I wonder, Dr. Evans, how you can sell to industries like beauty, personal care. They've been struggling. We had an owner on today saying that her mental health is suffering at this point. She hasn't been able to work or earn money for 10 months out of the last 14. How do you sell this plan that it's good and we should stick to it?
Well, I usually sell it by pointing out that one of the most prevalent criticisms has been, we open, we close, we open, we close. And this is our chance to really put this to rest and open and not have to close again, because that opening and closing cycle, from what I hear from business owners, small business owners, has been the real killer in all this, because they have to lay off staff, they have to organize supplies, et cetera. So I would say, stick with what's happening for the next couple of weeks. If we can do that, I think when personal service establishments are able to open with phase 2, then they won't face another closure. And I think that's really, really important to business, because this kind of yo-yoing back and forth between open and closed has really been, I think, one of the most severe consequences of the pandemic.
It has certainly made people's head spins. And Raywat, I want to talk about head spinning. It's this changing guidance, ever-changing guidance, it seems, on vaccinations. Today we find out that NACI has decided, if you got AstraZeneca the first time around, well, perhaps now you might want to get an mRNA, either Pfizer or Moderna. So again, it's this guidance changing. What do you make of this ever-evolving guidance, and what do you think of this recommendation in terms of the efficacy, because we're battling Delta now?
Well, the funny part is many of us were advocating for this weeks, if not months ago. So it's not surprising this is the guidance. It's surprising it came so late, frankly. So I approve of it. I'm not a clinician, but the extent to which I can advise people, I tell them, yeah, you should get an mRNA shot as your second shot. The data clearly points in that direction. But to answer your first part of your question, people should understand this is science in real time. Science is not about knowing all the answers. Science is about appraising the evidence as it comes in. And that often means changing directions as better evidence becomes available. So we don't have all the answers all the time. And that's the reality of the situation, unfortunately. Having said that, I understand that people are frustrated, but it comes down to decision makers now to make sure those frustrations do not boil over unwarrantedly. For example, will a mix and match vaccine strategy result in being denied entry to things, right? So we need accommodation for people who have been affected by this strategy.
Mm-hmm. And I wonder, Dr. Betts, what the situation is like in ICUs. What is the latest?
Well, we've certainly seen a decrease in patients presenting to hospital with severe COVID illness. That being said, we anticipate that there still will be patients coming in. In fact, this morning I admitted a gentleman that acquired COVID just in the last couple of days. So I think across the province, we anticipate that we will continue to see clusters and outbreaks, and we know that certain regions in Waterloo and Porcupine are experiencing a particular surge at the moment. But we're also starting to plan for the future. We know that many patients have had their care deferred over the last series of months and years. And so we're ramping up on our surgical programs and elective programs to make sure that patients get the care that's been deferred and the best care that they've been waiting for.
And Dr. Evans, I want to ask you, we heard today that south of the border, for example, in New York City on Broadway and perhaps for some NBC-related live broadcasts, that if you're a Canadian or anyone from anywhere around the world and you have a shot of AstraZeneca in you, they don't consider you to be fully vaccinated. I wonder, as an infectious disease specialist, your thoughts on that and what kind of an effect that could have, or a chill that may have on people being vaccinated here.
Yeah, it's going to have a chill for sure on people around the issue of AstraZeneca. They're starting to see what looks like a differential between them and people who've received the mRNA vaccines. I have to say that it's kind of one of those decisions which I think may be a little bit biased. It may be because the Americans who primarily used Pfizer and Moderna mRNA vaccines have never approved AstraZeneca. But we do know there's some data that the AstraZeneca vaccine seems to provide, I want to be very careful how I say this, because it does provide good protective immunity, but its sterilizing immunity is probably a little less. Having said that, its durability of immunity may actually be quite significant. And so I think the problem is that, are we going to see people with buyer's regret over AstraZeneca? And I would say no. That vaccine is going to protect you from severe COVID. It will protect you from having to go into hospital. And of course, the most dire consequence of COVID-19, which is dying. However, it's going to introduce a whole new sort of flavor to the concept of full vaccination versus partial vaccination, and what it's going to mean in terms of entry into perhaps countries like the United States, I think primarily because there was a fair bit of AstraZeneca used in Europe. And so I don't think it's going to impact on people traveling there. But we're going to have to see how this evolves. No question what my good friend Raywat Deonandan just said is that, if you've had AstraZeneca, get an mRNA vaccine, there's some good data that suggests it's a little bit augmented better immunity than getting back-to-back AstraZeneca. But really have to be careful. AstraZeneca is a reasonably good vaccine. It does its job. It protects you.
All right. Well, we appreciate all of you making time for us on CP24 tonight. Thank you, gentlemen.
Thanks so much.
Thank you.
Thank you.